Hey guys, welcome back to Medical Coding with Blue. Welcome to the first Friday Saturday edition. Yes, it is the Friday Saturday edition of Medical Coding with Blue. Yesterday, I'm not kidding you guys. Like literally my day started at 4:30 a.m. yesterday, which is not unusual for a weekday for me. But it started at 4:30 a.m. I didn't get into bed until like 1 o'clock in the morning. So, this is a very late edition today, and I am so sorry about that. But I hope you guys will forgive me when you see all the really fun questions I have today. I did throw in some more procedure coding for you guys because I think that it's important to start stepping it up on, looking up the different things and seeing how it relates to the diagnosis. I am eventually going to get into writing writing scenarios out so that way you guys can be able to start learning how to pull diagnoses out. Okay, so I'm going to share the questions and then I'm going to put them down in the description box below. Also, I'm going to give my thoughts on a comment that I got yesterday. So let's get started. So the first question is, left distal femur medullary. Yes, medullary. I looked up that word too, medullary. Left distal femur medullary bone infarct. Okay, that's number one. Number two is trigger finger of the left index finger, and they received one trigger point injection in the left finger. Okay, so I'm looking for the diagnosis and the procedure on that one. Okay, number three, again, diagnosis and procedure. Otitis media right, nonsuppurative. I said it right. Okay, chronic serous, right? And they had a right myringotomy under general anesthesia. Okay. Number four is a 12-day-old baby that has hyperbilirubinemia. Yes, that was a mouthful. Number five is sickle cell crisis with a fever with splenic sequestration. Okay. Number six is arteriosclerosis of a native vessel with unstable angina, pectoris. Okay. Number seven, and of course I'm looking for the diagnosis, and I will give you a hint. There are two procedure codes on this one. Okay, that's the only hint I'm giving you. So it is a nondisplaced fracture of the right medial humeral epicondyle, subsequent visit. They're coming in for a follow-up to do a routine change of the cast, and they applied a short arm elbow to finger cast. Okay? Remember, two procedure codes. All right? Number 8 is a preoperative appointment for a patient with morbid obesity with a BMI of 52. Okay. Number 9 is a bowing of the left femur. Okay. And number 10 is an embolism of the popliteal artery. Or popliteal. It depends on how you want to say it. Popliteal, I think it's the better pronunciation. Oh well. Embolism of the popliteal artery. Anyway, those are your questions for Quiz Friday. Again, I'm so sorry that it's that Saturday morning and we're just talking about this now. So, what I wanted to talk about from one of the comments that I got. All right, so if you are taking a medical coding class, right, and you get a certificate at the end that says you've completed your course in medical coding and billing, this is not the same as being certified, okay? In order to get certified, you have to go through one of the major associations, and there are two that I can think of, is the American Health Information Management Association and the American Academy of Professional Coders. Now, I always leave the link down in the description box below, but I'm just wanting to make this clear because I think sometimes it gets confusing when people say, oh yes, I've completed my program and now I'm looking for a job. Okay, well, are you certified? Because a lot of times when employers are hiring medical coders, they really do want them to be certified. Now, this is not to say that it's impossible, right? Because there's people that have found jobs that have had experience, but they're not certified. But usually, in those situations, they have their employment contingent on getting sort of certified eventually. So that's just something that you'll have to keep in mind. But if you have no experience and you're just starting out in the field, remember there is a difference between a certificate that says you've completed a program and a certification. A certification is going to give you those little credentials after your name. There's usually 3 letters, 3 to 4 letters, I think, for some of them, but mostly it's like 3 letters, like I'm a CCA. So there's people that are CCS, CCS-P, there's CPC, there's a myriad of credentials out there. So be sure that you are asking lots of questions, especially if you're just starting out and you're wanting to get into medical coding. Please do not get discouraged when you get a lot of no's in the beginning. This is something that I wish a lot of like recruiters from these trade schools would talk about too, because realistically, for some reason with medical coding, they want you to have experience before they even start hiring you, which is kind of hard if no one will hire you. But this is where ingenuity and trying to decide, this is what you want to do, and making sure that you are applying yourself and pushing yourself, because like I said before, medical coding will not want you in the beginning. It will fight you every step of the way. But if you continue to push back against all of that, eventually you can get in, depending on where you're applying. I went through a temporary agency. That was how I was able to get my foot in the door, because with a temporary agency, when they're sending you on assignments, all of those assignments that you get, they're a filler for your resume. So when they're filler for your resume, you have much more experience and you've been exposed to all these things. So that was just how I was able to get in. I went to an assignment, and that was a 3-month assignment. And then when that assignment got done, they sent me on another assignment, but I had to move. That was just my situation, what I had to go through. I literally had to move 8 hours away, but it was just something that had to be done. So, and at the risk of sounding like a broken record, because I don't want to sound like a broken record, I'm just saying, sometimes you have to really just keep after it and keep after it and keep after it. Eventually you'll get where you need to be. So that was my video for today. Again, guys, sorry about that. Like I said, Friday was just, 4:30 to 1 a.m. this morning. So, and as you can tell, my voice is a little on recovery still. So anyway, I will see you guys for Answer Monday, and we'll also have the countdown days on Monday as well. So yes, that was all I wanted to say. I was trying to think there was something else I wanted to say, but it's okay. If you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe to my channel and follow me on my journey in medical coding. All right, well, I hope y'all have a great rest of the weekend, and I'll see y'all on Monday. Bye.